I'm at Phoebe's beautiful Wilton Hospice House with Hospice Executive Director Jennifer Stevens. Jennifer, hospice care can be a difficult subject for families to talk about, but why is it such an important topic for them to address?
It's an important topic to think about before you need it. When patients and families are aware of services that are available to them at the time of a medical crisis, it makes choosing those services much less stressful.
Now, many people think, when they think of hospice care, they think, well, it's just in the last few days of life.
Right.
But hospice is so much more than that. Talk to me about some of the services offered here.
Ben, there's a misconception that hospice is available only for the last few days of life. One thing that we hear over and over from families and patients too that we've taken care of is that, I wish I had called you sooner. Hospice is designed for social workers, nurses, nurse practitioners, chaplains, volunteers, and certified home health aides to go into that patient's home and help them make important decisions. How do they want their last few months of life to look? We are able to manage symptoms at home. We hear from patients and families that they want to die at home, surrounded by family and friends and community, and hospice allows that to happen. Our goal is to keep patients out of the hospital so that they can enjoy their remaining days at home.
You mentioned some of the professionals that are part of the team here.
Right.
Why is that team approach so important?
So hospice takes care of the mind, body, and spirit, and each team member on our team is focused on one area. Our nurses and nurse practitioners, along with our physicians, take care of that physical component. Our social workers are taking care of psychosocial issues, emotional, social, practical issues, assistance with advanced directives, funeral planning. And then our chaplain is there to help with spiritual closure, questions about the afterlife. Our volunteers are amazing. They are there for companionship, just to have someone to talk to. And our home health aides come in to provide physical care, personal care.
So how does a family or a patient really know when it's time to utilize hospice care?
Well, of course, patients and families are encouraged to talk with their physician about that, but at the time that they have decided that they don't want to return to the hospital, or they are no longer interested in pursuing aggressive treatment and are looking for comfort care. Patients might be having more difficulty getting out. They could be having more difficulty swallowing or ambulating or needing assistance with personal care. And of course, it's always best to equip yourself with the knowledge of services that are available so that if you are given a terminal diagnosis, you know what services are provided.
We're at Wilton Hospice House.
Yeah.
This is one of the most amazing hospice facilities in Georgia.
It is.
Tell us a little bit about this wonderful facility.
So the Wilton Hospice House is owned and operated by Phoebe Hospice. Phoebe Hospice is the only hospice in our area with a freestanding inpatient unit. It was built by our community and is maintained through our community. We give it back to the community. It is a phenomenal place. A lot of rest and healing occurs here. It's unlike the hospital setting. Our medical gases are hidden. It's very quiet, it's serene, it's surrounded by beautiful trails, gardens, and quiet areas.
The trails are even open to the public.
Yes,
right?
they are. We encourage anyone to come out and utilize our trails.
Jennifer, thank you for your expertise and for all that your team does here at Wilton Hospice House.
Thanks, Ben.